$1,118.90 for a troy ounce.
All right, the drive by House Democrats to vote on the massive health care reform bill is still alive.
Leaders expecting the vote to happen on Saturday, the weekend. To the likelihood of all this happening, Democratic Congresswoman Jackie Speier of California and Republican Tennessee Representative Marsha Blackburn, they are both with us now. Good to see you, ladies. Ms. Blackburn, first to you. Are Republicans, we know the Democrats are going all out, particularly the president trying to persuade members of his party. Are Republicans also pulling on the shirt sleeves or the shirt tails of these Democrats that are on the fence?
We are continuing to talk not only to our colleagues, but to our constituents and to their constituents, because they're calling us many times saying, you know, I've got questions about this and I'd like to get some clarification. So, absolutely, this is a very serious issue. It would have very serious implications for our nation's economy and our nation's health care. You know, you can look at what has happened in Tennessee, Massachusetts, and Maine. There is no example where federal government control has ever increased access or brought down the cost of health care.
Congressman Speier, what do you make of the number of voters who are calling the Capitol Hill right now at the urging of Rush Limbaugh saying, look, we don't like this bill, stop it, you know, do something, do a better bill, we don't like it?
Well, we're hearing from Rush Limbaugh listeners, and we're also hearing from those in our districts. And in my district right now, it's running pretty strongly in favor of health insurance reform. And all you have to do is look at what it's going to bring to the average person. Do you know that a 40-year-old woman who does not smoke pays more for health insurance than a 40-year-old man who does smoke? Those are the kinds of forms of discrimination that will no longer be allowed in the new health care plan.
By the way, Marsha Blackburn, we understand that Nancy Pelosi did try to get the ladies in Congress together for a meeting on this. Did that include Republicans?
No, it did not. What our understanding is it was Democrat women. And but, you know, we have to look at the fact that this has been those from the Democrat Party trying to have meetings and committee meetings and deal with this. And I think in answer to what my colleague said about what this bill is going to do, I have two grandsons. What it is going to do is cap their future, because it is going to leave an enormous debt for them. CBO says this is going to be $1 trillion at best. It is going to pile on to this enormous $13 trillion debt that we only have. They do not have the money. This bill is too expensive to afford. We have heard that from our governors. We are hearing it from state legislatures. They don't have money, cannot do this bill.
Now, Congressman Speier, what happened at the meeting with House Speaker Pelosi? Did you attend? Did you hear what happened?
I did attend, and you know, the truth of the matter is that Speaker Pelosi meets with groups of members all the time. She meets with the freshman Democrats, she meets with the sophomore Democrats, she meets with the women Democrats. That happens all the time, just like the insurers meet with the Republican membership. I mean, it's just the nature of our business.
Marsha Blackburn.
The leader has.
Yeah, go ahead. Finish up.
The Speaker has never invited the Republican women to come and weigh in on this, and I would love for her to do that, because women in this country are the drivers on health care. They're the ones that are making the decisions on health care. They have spoken out in poll after poll by over 70%. They do not like this bill, and they feel very disenfranchised from the system. Indeed, one of the polls I saw, Moms That Rule, their poll last year showed that over 85% of the American women did not think that Congress was speaking for them or representing them on the health care issue. That's how out of touch they are on this.
Well, if I could respond to that.
Sure.
The truth of the matter is that 60% of the women in this country are underinsured. If you talk to any woman between the ages of 55 and 65 who is no longer employed, she can't get health insurance in this country because she's got a pre-existing condition and she's too young for Medicare. There are 1 in 8 women in this country who have breast cancer. There are 140,000 people that die of cancer each and every year in this country. For us not to have a health care plan that provides health care for people who need it is shameful.
But 60%, Congresswoman, I think that figure, when you use it, 60% of the women in America underinsured. What do you mean by underinsured?
Well, let me tell you how that works out. And I'll take, for instance, the situation of maternity care. Most of the popular plans, the health insurance plans in this country now, 90% of them do not cover maternity care. In fact, in Congresswoman's district in Tennessee, there is not one plan that offers health insurance with maternity care for a woman at the age of 30. Now, that's unacceptable. I used to be a legislator in California. I tried to carry a bill that covered maternity care as comprehensive health insurance.
Let me respond to that, because her figures are quite wrong on that. And if having public option health care and expanded Medicaid gave you the best health care and it answered all the questions, Tennessee, who has been under this program since '94, would have the best access, the best outcomes, and you can see it has driven up the cost, it has limited access. In order to have more people covered, bring down the cost, and to have greater competition, they are on the wrong road, and we need to do this in a patient-first, not a government-first manner.
Ladies, great debate. Thank you both for coming in.
Thank you
Jackie
so
Speier and
much.
Marsha Blackburn.
Really
good to see
appreciate
you.
All right. An influential Democrat